Hi everybody, I'm Katie Kelly. I'm one half of Motherhood Link, and I'm here to talk to you today about silicone treatments for C-section scars. So I will sometimes have patients that will present with C-section scars that are older and that haven't healed really well, or I'll have someone that I know is going in for a surgery and they have in the past been prone to not having good scar tissue. So when they heal from an incision, that their scars they don't look the way they want. So what I'm talking about is a scar that would stay really pink or really red for longer than we'd expect. It would be raised or it would be thick. It might not be as flexible as you like, and it can be itchy. So those are the signs that someone might benefit from using a silicone scar treatment. So what I mean by that is a silicone is an elaster product, and it will have come in a form of either a gel like a cream or something like a sheet. So in the clinic we find that the sheets work better, mostly because they're in this area, and I find that pants will rub it off or shirts will rub it off, but I've certainly recommended the creams to people for their face or for their hands or things like that. But this is kind of what the product looks like, so I'll show you here. So you can get it in what looks like a big square paper form, or you can get it in this little tape, which I like the tape because you don't have to cut as much, and I'm kind of a lazy physio. So you would take the tape and you kind of measure it out to the size of the scar, and then you would cut, and then you can just peel it off the backing. So it's just sticky. See, I can say peel it off the backing. Okay, this camera's kind of at a weird angle. Okay, so I guess I should show you. I should have planned this, but you can then just like stick it over a scar. C-section scar's not this high, but I didn't plan a good outfit. So you can stick it over the scar, and then you can just put clothing on it, and it will stay there all day. My recommendations are to keep it on throughout your day if you can, and then when you go to bed, take it off, and then you can put it back on. You can take it off. I'll show you what it looks like. So it just peels off the same way. Peels off, and then you can put it back on the plastic backing to save it. And providing you don't have an open wound, like you wouldn't use this over an open wound. You have to actually have a scar to work on to put this on. So providing you don't have an open wound or there's an inactive infection and the scab is gone, then you can put this on, and you can reuse it for, I don't know, up to a week. You want to look and make sure that it's clean. Some people claim they can kind of rinse it off a little bit depending on the silicone product. But take it off at night, let your skin breathe a little bit, put it back on the next day. There are some people that will there's a subpopulation of people that will get an improvement quite quickly within a few weeks to a month. And there are more severe scars that will take 6 months and onward to see an improvement, but generally I see within 4 to 8 weeks we start noticing improvement. I had a patient that was in last week that I had sent her away with this for 6 weeks, and she came back and she showed me, and my mouth literally went like like I was amazed, because it was an older scar and it was quite hypertrophic. But this has worked wonders. So this product that I have here is the Mepi Tack, but if you go to our website, I've got listed the tapes and the sheets that we really like to use and that I've been using often. You can also ask us any questions that you like. You can post below, and hopefully you will find some use for using some of those silicone products on your patients. All right, bye-bye.